Hi everybody, it's Dr. Tenenbaum, and I am doing today in our series for facial rejuvenation, we are going to talk about rhinoplasty, which is our medical word for a nose job. We hate the word nose job, but rhinoplasty, so basically addressing the nose from a cosmetic as well as potentially a functional standpoint. So what is rhinoplasty? Rhinoplasty is surgery of the nose. Typically, the nose can be approached what's called an open rhinoplasty, where you do have a very small scar on this part of your nose called the columella, and then inside the nose, which you don't see. Or closed rhinoplasty, where you don't have that scar on the columella. In my opinion, open rhinoplasty often allows us as the surgeon to do a better job on your nose and really approach all of the aspects of your nose more easily and allows better precision. So my preferred technique almost always is going to be an open rhinoplasty. So what can we address when we do open rhinoplasties? So there are a number of areas that can be a concern. The first and most important thing is to go to a board-certified plastic surgeon and discuss your concerns with that provider and have them evaluate your face. So when we're evaluating somebody for a rhinoplasty, we're looking at multiple things. We're looking at the nose itself. We're looking at the size of the nose, the shape, the projection of the nose, or how far the nose projects off the face. We're looking at the rotation of the tip. We're looking at what the tip itself looks like. We're looking at the nostrils or the ala and the base and how wide or narrow that is. We're looking at the dorsum of the nose, if there's a hump, if it's wide, if it's over projected, if it's under projected. We're looking at the radix, which is this area here, and again, if it's over projected, under projected, etc. We're also looking at how the nose relates to the other features of the face. So Dr. McCatton talked to you last week about the chin. So often when we are evaluating for rhinoplasty, we're also looking at the chin and the cheeks and the forehead. We're looking at the relationship of the projection of the nose to those things. And then from this standpoint, the height of those areas compared to the height of the nose. So we're assessing a lot of things. Finally, we're also looking at the function of your nose. So we're going to look inside your nose. Hi, Chris. We're going to look inside your nose and look at your airway or your breathing. We're going to ask you questions about breathing, whether or not you have any trouble breathing. Some people feel that they definitely have trouble breathing. Other people may say, well, maybe I'm stuffy, maybe it's allergies, and it could be, but there could be some functional or anatomic reasons inside the nose that you have difficulty breathing. So that can often also be and should be addressed at the time of a rhinoplasty. So as far as surgical rhinoplasty, typically patients are asleep in the operating room. They do have a breathing tube down, and they are not aware or awake during the procedure. The procedure is done where we alter all those things I just talked about. We usually have a very detailed plan going into the operating room about all of the factors that we're going to address and exactly how we're going to address them. So again, we may be bringing down a dorsal or a hump here. We may be addressing the tip of the nose. We may be addressing the alar base, and we may be addressing something on the inside of the nose, either to help improve breathing or to use some of the cartilage from the inside of the nose to graft, meaning we borrow cartilage from one area, the inside of the nose, and then we cut that into pieces that we want to use, and then we use that in areas of the nose to help build structure or make structures stronger or to shape the area. So that's called cartilage grafting, and not everyone needs cartilage grafting, but a lot of people do. And again, sometimes the cartilage grafting is to shape or position things. Sometimes it is to also help improve breathing. There are certain grafts that we do that can kind of open the airway on the inside and improve breathing. So rhinoplasty is a classic example of improving the form, but also potentially improving the function, which is a really, really nice thing. So again, we go into the operating room with a really detailed plan. We perform that plan, and then before you wake up, you've got some stitches on the inside of your nose that dissolve and some stitches on the skin of your nose that we take out. We typically put a splint over the top of your nose. A bare minimum splint would be a tape splint. I love tape splint. You can ask my residents. I have a very particular way I like to tape the nose. And then depending on if we've done any bony work, like breaking the bones here to narrow or widen or improve some asymmetry, we will also sometimes put a hard splint on the outside of the nose. And then again, depending on the procedures we may have done on the inside of the nose, sometimes there are also some very rubbery type splints that go on the inside of the nose. Typically, you can go home the same day, and you will have ice packs on your eyes, and you'll take it easy, keep your head elevated. And then again, we see you in the office the following week, take out stitches, often take out the internal splints. The external splint, again, it's going to depend on what your surgeon did when they feel comfortable taking that off. I personally like to leave people taped for a few weeks. And then once the tape comes off and people sort of get back to their normal life, then I usually try to teach them how to tape themselves at night. And the reason I do that is because I think it really helps with swelling. So people can be swollen. Their nose can be a bit swollen after rhinoplasty surgery, sometimes for up to a year. And I always explain that that doesn't mean it's huge. It just means we may not see that very final result for several months to a year. Usually, though, we can already see a nice correction even when that first splint comes off. So that's always a really fun day when patients get to see their nose for the first time after those splints come off. As far as recovery and downtime, it's usually best to plan for at least a week, up to 2 weeks of downtime where you don't really have to be in public a whole lot because, again, you're going to have that splint on your nose. You could have some bruising and swelling that's visible, even black eyes, if we had to adjust some of the bones of the nose and face. That's not always the case, but it's better to plan for it. Then after that, usually people can return to work and return to normal life, but avoiding any strenuous activity or strenuous exercise for up to 4 weeks. The things to look out for with rhinoplasty are some asymmetries in the nose. Nobody has a perfectly symmetric nose. Sometimes people have a crooked nose deviating to one side or the other, and that can be addressed with surgery, but again, it may not be perfect. And you can have some changes over time where the cartilage can change over time, and so that's a risk of surgery. There's also a risk of having difficulty breathing after surgery. And again, a lot of what we do, we're trying to improve your breathing, but there's always a risk that you could have backpedal in your breathing. And so sometimes that can be addressed with further surgery. Again, it's best to go to an experienced rhinoplasty surgeon to try to avoid those things in the first place. One thing that is nice that a lot of us can do nowadays, and it really helps foster the discussion with you and your surgeon, is 3D photography. Now, the operating room is not a computer. You're not getting a nose transplant. You don't get to bring in a picture of somebody else's nose and say, okay, give me this. But with the 3D photography, what we can do is take a picture of your nose and then do some alterations on the computer screen that we think are reasonable to make sure that we're on the same page with what you are hoping for. Some patients come in with a goal to just do some very minor refinements, like take down a very small hump and maybe improve the tip so it looks slightly more refined. And other people are really looking for a bigger change. So it's really important to have that conversation with your surgeon and make sure that you're on the same page, and make sure that your surgeon thinks that what you're looking for is realistic. And if they don't think it's realistic, you guys need to have a really good conversation about what is realistic and if that's going to be okay with you. Let's see. Other questions that have come in. If I've had nose surgery before, can I still have a rhinoplasty? So yes, usually. So it depends what you've had done. If you've already had a rhinoplasty, your surgeon is going to really want to look at what was done before. It's nice if we can find your old operative reports from your other surgeon if it wasn't us, so that we can really see what was done, what was removed, what was left behind, cartilage grafting, etc. That's really, really important for us to know what we're getting ourselves into. Revision rhinoplasties are typically trickier and more complicated because patients have scar tissue. They may not have as much cartilage left, etc. So it's really, really important that we know that ahead of time. Some people may have surgeries like, let's see, maybe they had a broken nose when they were younger and the bones were reset. So again, important to maybe look at operative reports of what exactly was done. But that actually is quite common, and that in fact leads to a lot of people seeking consultation for a rhinoplasty. They've had a fractured nose in the past, and maybe they have some deviation or some deformity that they're hoping can be corrected with more nasal surgery. Some people maybe have had breathing type surgeries, something called a septoplasty. So that septum is on the inside of your nose at the midline, and that is partly cartilage and partly bone. I explained that sometimes that can impact your breathing if it's bowed one way or the other. And sometimes people will have something called a septoplasty to help with that breathing. So maybe they've had a septoplasty in the past and now they're looking for more of a cosmetic rhinoplasty. Again, really important to know going in because there may not be that much cartilage left at the septum. And if your surgeon thinks that they're going to need cartilage for grafting, etc., they may need to look elsewhere. Like the ear cartilage is a common spot and rib cartilage is a common spot to go to get cartilage if the septal cartilage is not available any longer. Again, these types of things are super important because the most important thing is the structure of your nose and being able to breathe and function. And so no aesthetic outcome is worth not being able to breathe or having a functional nose. So these things are really important to discuss with your surgeon ahead of time. If you've had surgery to the skin of your nose, let's say you've had a skin cancer removed or you had a trauma and you've had stitches on the skin or something along those lines. Again, your surgeon should look at those scars and see whether or not they think that could potentially compromise the surgery or the outcome. And again, they'll have that conversation with you if they think that it potentially isn't safe. Okay, another big, so that's a lot about surgical rhinoplasty. Again, the take-home points are see a board-certified plastic surgeon, discuss your goals, be really honest about any prior procedures or surgeries you've had in the past. 3D photography can be really important to facilitate the discussion between your goals and what is realistic. So those are the big things. And then the recovery, we talked about that. Now, there's also something that's becoming more and more popular called non-surgical rhinoplasty, which is injections. And we touched on this briefly when we had our filler talk with Emily and Lorraine. So non-surgical rhinoplasty involves injecting fillers to different areas of the nose to change and improve the aesthetic outcome. Not everyone is going to be a candidate for this. And again, it's going to require a conversation. I prefer you see a board-certified plastic surgeon even for these injections because, again, we really understand the anatomy of the nose, including the cartilage, the bony structure, but also the blood vessels, etc. And non-surgical rhinoplasty can be extremely dangerous. Okay, so that's really important to know. You want to see somebody who truly knows what they're doing and has experience, hopefully with surgical rhinoplasty as well, because I think that really makes a big difference in not only the safety of your non-surgical rhinoplasty, but also what can reasonably be done to improve your outcome. That being said, fillers can be injected in certain areas of the nose to help camouflage defects. So a classic example would be somebody who has a hump on their nose. We can inject filler around the hump that can give a smoother, straighter appearance to the nose. We can inject fillers to the tip of the nose to help improve asymmetries or support. I told you we're looking at the rotation of the nose. So some people who may have their nose is slightly down, turned this way, sometimes we can use fillers to give the illusion that it has a little bit more of a turned up appearance, which we do surgically. We can do that with fillers as well. Sometimes we can use fillers to change or alter the shape of the nostrils. All of these things are going to be subtle improvements, but they can really make a big difference. And fillers in the nose often last about 2 years or so. So that's also important to know. It's potentially not a permanent solution, so that can be good or bad. If you don't love the correction, it's not going to last forever. If you love it, you can repeat it, or it may push you towards pursuing more of a surgical or a more permanent option. So that's also something very exciting that is out there. Let's see, what else? Other questions that came in are, if we do an open rhinoplasty and I have that scar, how visible is it going to be? So typically that scar heals beautifully. And as I mentioned earlier, I do almost all open rhinoplasties because I simply feel I can do a better job addressing those areas of the nose that we talked about. And I think the outcome is better. So we do care a lot about that scar. We don't want that scar to be noticeable to other people. At first, scars are more pink and noticeable. So after your sutures come out at day 5, it's going to be a little bit pink. From that point, it starts to lighten and fade. We usually have you do silicone scar gels, and you can even start on some Retin-A in a few weeks. Again, ask your surgeon when they feel comfortable. And that scar generally will start to fade and be very difficult to see. The scar never truly goes away, but it often can be really tough to see unless you're looking very close. Other things that can be done to help improve the appearance of scars on the face are things like microneedling. We've talked about that. I think we might even have a session specifically on microneedling coming up. And microneedling can be a great thing for scars. And let's see, lasers. Some lasers can help. Again, if the scar remains a little pink, then we have some lasers that can help take some of that pink out. If it's a bit raised, we have some lasers that can help resurface it. So usually not necessary to do those things. Again, usually it heals beautifully, but if it doesn't or it still looks a little bit visible, we can do some of those treatments to help improve the appearance over time. So that is rhinoplasty in a nutshell. It's a very complicated topic. Rhinoplasty is a very complicated surgery with a lot of moving parts. So again, I will reiterate that it is most important that you see a board certified plastic surgeon who does rhinoplasty surgery and has a good understanding of what you're looking for and a good ability to tell you what is realistic. So if you are considering a rhinoplasty or a non-surgical rhinoplasty, I'm happy to see you and evaluate you and answer any further questions. But rhinoplasty can be a very life-changing, very satisfying type surgery to really improve people's confidence. Noses are a tricky thing. It's right on the middle of your face, and if somebody has been self-conscious about their nose, especially since they were a kid or whatever, doing some of these things to really help improve the appearance of the nose can be life-changing for a lot of people. So it is fun to get to do that and really make a difference in people's lives and their confidence levels. So again, thank you guys so much for tuning in. I hope you found this informative. If you have more questions, please go ahead and message us and we'll be happy to answer them or address them in a later post. We will be back next week with another Facebook Live, and I hope you'll tune in for that. Okay, thanks everybody. Have a good rest of your day.